This is a speech about childhood PTSD. So, in a study published in 2005 by the Crimes Against Children Research Center, 530 per 1,000 children aged 0 to 17 have experienced physical assault. To put that into perspective, as of 2018, there were 77 million children, according to the United States Census Bureau. And with 53% having experienced sexual assault, that means just over 40 million children are susceptible to PTSD. Childhood PTSD can be difficult to diagnose and treat for many different factors, but the two main are age and developmental stage. My career goal is to be a pediatric nurse, so I have investigated different types of childhood mental disorders. Childhood PTSD stood out to me because it's correlated with some of my life events. Because of the professional and personal connection, I took a deep dive into different aspects of the disorder. You see, most of us have experienced a child who's had a behavioral episode, but our reaction is to either push it off as a normal child behavior or to push it off as a quote-unquote problem child. But those behaviors may mean a lot more than expected. Today I'm going to explain the symptoms, the process of diagnosis, and different treatments for childhood PTSD, and why the diagnosis and treatments may be more difficult for younger children than adolescents. First, let us look at some common and uncommon symptoms of the disorder. Most symptoms presented in adults with PTSD may present in children diagnosed. Children will experience some sort of nightmare in their lifetime, but with PTSD, it can be vivid and intense nightmares that can last for months and into years. The nightmare can be the traumatic event or their interpretation of the event reoccurring over and over and over. Along with the nightmares, the child may become very jumpy and easily startled at any trigger that can remind them of the event. A child who has negative core beliefs may also be showing signs of PTSD. Negative core beliefs include lasting worries that the event will happen again and that the whole world is out to get them. Negative core beliefs include feeling guilt or shame that the event even happened. Children with the negative core belief symptom may say that the entire world is unsafe or out to get them, and it can trigger separation anxiety with their safe person. Another symptom that is rarely talked about is backsliding. Backsliding is when a child has reached a certain developmental stage in their life, but suddenly reverts back to prior behaviors. For example, a child can be fully potty trained, and then all of a sudden, they're having very frequent accidents, and they seem to have forgotten how to use the potty altogether. These symptoms, along with many others, is what is used to diagnose PTSD. Now, let us talk about how children are diagnosed with PTSD. There are four main diagnostic criteria that professionals use. The first measure is that the child had to have been exposed to the traumatic event, where the event was either life-threatening or the response involved very intense fear. The second is that the child persistently is re-experiencing the trauma event with at least recurrent and intense nightmares or acting as if the events were reoccurring. In young children, this measure can also include traumatic-specific reenactment. The third measure is avoidance of reminders and new numbing of general responsiveness. In this measure, the child will show detachment from others, efforts to avoid thoughts, feelings, and places that remind them of the event. The last measure to look for is persistent new symptoms of increased arousal by angry outbursts, difficulty concentrating, and exaggerated startled response. Elementary age children may also experience time skew and omit information. Time skew is when a child missequences the trauma-related events, and omit information is when a child believes that he or she knew it was going to happen before it even happened. In all of these criteria, the child must meet 1, experiencing, 3, avoidant or numbing criteria, and 2, hyperarousal for a minimum of at least 1 month to start the diagnostic process. Lastly, we're going to go over the treatments. There are a few different treatments involved that all depend on the severity of the PTSD. But according to a 2014 article from the National Center for PTSD, the most effective approach for treatment is cognitive behavior therapy, or CBT. The empirical data shows that trauma-focused CBT is the best therapy for children ages 6 to 17. In trauma-focused CBT, the focus generally includes the child directly discussing the traumatic event, anxiety management, and the correction of inaccurate trauma-related thoughts. In this process, the child learns that they don't have to be afraid of the events that happened. And they also learn how to relax when recalling the events that happened to them. For children under the age of 6, it is shown that play therapy and other specialized interventions are needed. Play therapy is when a therapist uses games or drawings to help the child through the memories. This technique is mostly used through smaller children because of their inability to effectively communicate and their developmental level. Childhood PTSD is a very dependent mental disorder that can take months to diagnose and even longer to treat. In conclusion, children ages 6 to 17 are easier to diagnose and easier than their young peers because of their ability to express and process their traumatic events, along with the use of CBT. Because elementary age children cannot express themselves and experience time skew and omen information, it can be more challenging in treatment and diagnosis, and that is why specialized health professionals intervene along with special treatments like play therapy. Remember, there is a greater than 50% chance that you are around a child who is going through the worst experience of their lifetime.